because with eating healthy, it comes with preventing many, many diseases. So many times, especially in Namibia, we have diseases which could be easily preventable.
Having a chat with some special guests in the building today, aiming to increase cancer screenings and educating people about health-related issues, and at the same time provide support to patients and their families. We are joined by Dr. Iyaloo, who is the founder and volunteer doctor at Petwa Foundation, and Ms. Helmi, who is a nutritionist intern at Petwa Medical Practice, to elaborate more on what we're talking about today. Firstly, welcome to 99 FM.
Thank you very much. Thank you for having us.
And not so nerve-wracking. It's a calm conversation. You're not too nervous.
No, we're fine.
Yeah,
now.
that's what I like to hear. So let's dive straight into it. Actually, just if you can briefly elaborate on the services that are provided by the Petwa Foundation and the idea behind it.
All right. So Petwa was established in 2019. That's when we first had our first event, and officially registered it in 2020 with the Ministry of Health and Social Services. And the idea really just stemmed from the fact that there is still so much more that we as health professionals can do for the community, especially for people that don't really have access to health services. And that's when the idea came about to have an organization and use our platform to just call on other professionals and stakeholders to go out there and reach out to the masses, give health services for the people that cannot have access to public and state private health facilities. Yeah.
Why cancer specifically in this case? Would you say that there are challenges in terms of maybe education, support, diets, and screenings amongst the communities? Why do you, or lack thereof rather, why do you think that's the case, and why cancer specifically for this event?
Okay, so it's really, and one of the things we love to communicate is that prevention is really much cheaper and better than cure. So cancer is the cervical cancer screening and preventing cervical cancer, therefore, is really because this is one of the most commonest cancers in our country, and even with the breast exams, so together preventing breast cancer and cervical cancer, so very common cancers amongst women, and something that can be prevented. But it's also people are not coming forth to use the services, maybe because of the lack of knowledge that there's prevention for this and there's screening that can be done to avoid this. So they show up so late in the disease progression, and it's sad to see because it's something that we can do something about, we can prevent, and that's why we have taken on this initiative.
But is there anything in the pipeline that we can look forward to perhaps?
Yeah, we will hopefully have more healthcare professional volunteers coming on board, and then more events in the city as well. But the plan is to roll out the services to the remotest areas of Namibia.
As we say, coming out of the pandemic like it is done, but and that's not the case, and maybe that's also part of the awareness that we need to spread to people that, like, you know, the world is under a health attack, if you will, in many ways. And just as medical professionals, what piece of advice would you give to the listeners out there now, maybe not necessarily related to what you will be speaking about and what Petwa is busy with right now, but just generally as a health professional, what advice do you have for the listeners out there right now, as brief as you can?
Should I start? So as a health professional, especially a nutritionist, I emphasize on eating healthy, because with eating healthy, it comes with preventing many, many diseases. So many times, especially in Namibia, we have diseases which could be easily preventable. So I advise everyone to take care of themselves through eating healthier, living healthier. So for me, is do not let it come to a stage where you are required to go to the hospital or see a doctor, but you should, take the stand for yourself and do better for you, to just, live a healthier life and also just have a good quality of life in general. Yes.
Dr.
Yeah, just to add on, just with eating healthy, just again, prevention is better and cheaper at the end of the day. And that's the reason why we're having these free services, just to emphasize the importance of checking in with your health. Health is wealth, and if it's not taken care of, it's really expensive in the end. It costs a lot, and it's really best to check in with your health. It's now free services, so people can come in. There is no excuse. And yes, one should really just prioritize their health and not wait until it's too late.
100%. I fully agree. Let's eat healthy. Let's prevent, because it is not only easier to prevent, but cheaper in the pocket. Thank you so much for joining me today. If you are tuned in, that was Dr. Iyaloo, who is the founder and volunteer at Petwa Foundation, and Ms. Helmi, who is a nutritionist intern at Petwa. Thank you so much for joining me today.
Thank you very much for having us.
MYD Heart was proudly brought to you by NHP. NHP, we are about you.